Mike. I'm Andrew. I'm a doctor in San Francisco, and I'm CEO of SharePractice. And I want to tell you why doctors, good doctors like me, make bad decisions every day with patients like you. And it has to do with where we get our information. Doctors don't have time to read every single journal article. It's an antiquated model, so we rely on reference tools to synthesize information for us. And reference tools look like this. It's really straightforward. You look up the diagnosis at the top, in this case a urinary tract infection, and you see the treatments listed below. So you know, like when you go to the doctor and they leave you alone, naked in a room, wearing a paper towel with your legs swinging? Yeah, we're outside looking at tools like this. Well, we're probably Facebooking a little bit, but for the most part, we're trying to figure out, yeah, it's not funny. Doctors actually have Facebook groups where we try to collaborate and share our experience. And the reason that's so important is because I've treated literally thousands of UTIs, and I can tell you from my experience that my first choice is their last choice. And my second choice, it's not even on this list. And I never prescribe those primary options because in my experience, they just don't work. This is terrible, and I have no way of feeding information back into the system and telling other doctors what I think. So let's talk for a second about experience. I think in any industry, experience is probably the most valuable asset you have, but in medicine, the best way I have to share my experience is this. This is a real text message between me and Dr. Mark. He's working in the ER, and at 6 in the morning, he's texting me, asking me how I treat a UTI because he wants the benefit of my experience. And if I'm not up at 6 in the morning to answer him back, he's going to wind up making a bad decision if he relies on the tool I just showed you. So the problem is this. Good doctors like me and Mark wind up making bad decisions because we have no way to share our experience. So SharePractice structures and shares doctors' experience. Let me show you what I mean. We're going to run with the urinary tract infection example because I know it's gross, but I'm sure every person in this room has either given or received one at some point. So you search for a UTI, and here you see all the treatments you have available. Now, the main difference between us and the other one I showed you is that these treatments are actually ranked by doctors upvoting and downvoting these treatments. It's a curated list, and you can see we have a lot more than was on the previous screen. I'm going to click on cephalexin because it's the top one here. And here you see the different ways you can combine cephalexin with other drugs, in this case, probiotics. We click on that one. And now you see the clinically relevant information. This is what a doctor needs to actually write a prescription, the dose, duration, and frequency. But most importantly, you have comments from other doctors telling you why this is the best choice. The third guy on the list here, he's a urologist. We click on him, urologist at Stanford. He's commented on lots of urinary tract infection stuff. I'm going to follow him, as he seems like he knows what he's talking about. Come back to this screen, and you know what? I've actually used this drug to treat UTIs. I'm going to go ahead and give this a thumbs up. And boom, 10 seconds, I got the information I needed, and I was actually able to participate in the process. So we have much more than UTIs in SharePractice. You can search for something as common as a migraine, see all the different kinds of migraines, or you can search for something as random as like idiopathic thrombocytopenic purpura. We got that too, and we got a community of verified doctors collaborating around the best way to treat this. Okay, so how have we been getting doctors to use this? So here's another screenshot from my phone. More than 50% of the contacts in my phone are doctors. So we know you're looking at a urinary tract infection. You click the share button, you select the doctor contacts, and now SharePractice generates the email for you. Hey, Andrew wants to know how you treat a UTI. Click here to respond. The answer comes back structured. It lives in my reference tool forever, and SharePractice just grabbed a new user. Viral model is baked right in, and it's working beautifully. Okay, so obviously this is pretty cool. It's going to change a lot of things. How come no one else has done this, and how come we've been able to? And it has to do with dementia. So here's the problem. You can have 15 different doctors talking about the word dementia, but are they talking about Alzheimer's, degenerative dementia, Parkinson's, or are they talking about somebody who decided to start a company? In order to account for all the variance in medical terminology, SharePractice built a proprietary medical ontology that took multiple databases, treatment databases, diagnosis databases, put them all together, and actually made sense of this information. Okay, so what does all this mean? It means that we're able to collect data. We're getting important information on the most valuable customer in a $10 billion analytics market. And the coolest part is that we're getting data that doesn't exist anywhere. Every Walgreens knows that, Dr. So-and-so prescribed Lipitor to treat high cholesterol, but only SharePractice knows why. And that's incredibly important. Why did he choose Lipitor over simvastatin or cholestyramine or fish oil or niacin? This information doesn't exist anywhere else. Okay, so what does this mean for medicine? Well, we don't really know because this has never happened before. We've never had a global collaboration of doctors sharing their experience. But what happens when you get doctors in New York collaborating with doctors in Zurich and then sharing that information with healthcare workers on the ground in Uganda? Are we going to learn new cures for diseases that have stumped doctors? Yes, absolutely. We're already learning a ton. And then, so what does this mean? Whoops. What does this mean for you as patients? Well, it means that it doesn't matter if your doctor has experience or doesn't have experience, is good or bad. If he's using SharePractice, you can be confident that you're going to get the best treatment because effectively, SharePractice puts 1 million doctors in every doctor's pocket, and you're going to get the benefit of all of that experience. Thanks.
Judges.
Hit me.
Doctor quality.
Thank you, sir.
How do I trust that the doctors that are in this ecosystem are trusted doctors?
Yeah, so our partner is Doximity. Their whole business model is verifying doctors. So they have an API, we run doctors through their system, they're verified, they're vetted, and then they use that login to log in with us. Eventually we could build our own, but for right now we're going with Doximity.
Two questions. First, it wasn't clear, is there a combination of existing clinical data or outcomes combined with the sort of anecdotal, so both appear in the product?
Yeah, we start with all the publicly available data that all the other tools have, and then we give that to doctors to curate. So yeah.
And is there an admin type or a group level product available? So, because don't hospitals and medical groups collect outcome data, and under the ACA they have to start paying on outcome data or being paid on outcome data? And is there a way to work sort of official outcome data into the product on a group level that the hospitals say may already be collecting?
Yeah, I mean, that's part of our business model is figuring out the most efficient ways that large groups can actually do that kind of stuff. And in the future, that's absolutely part of our model.
Cool, really cool.
Thank you, yeah.
Okay, first of all, I can tell you that in Israel, I'm sure it's going to be a great hit because, as you know, most of the population in Israel is Jewish. So in every hospital, there is a huge sign, bring the second opinion first. So this will be, this will be perfect.
Yeah.
Also, combining medical doctor with the whole ecosystem of the startup, it's the dream of every Jewish mother, you know? So this is really resonate very well with me, I must tell you. I didn't hear at the second example, I didn't hear if the doctor was urologist or neurologist, but
He was a urologist.
urology. Yeah. Okay, that makes more sense.
Yeah, it does. It depends on where your brain is, I guess. But.
I have no idea how to follow up this. Well, I think it's great that you're trying to disrupt an area that I've wondered for a long time why it hasn't been disrupted. I guess one question, because it goes back to a joke that we kind of have at Yahoo, which is that Yahoo Answers tends to be every college kid's health plan.
Yeah.
Right?
Yeah,
Like
totally.
you have a question, like how do I treat this? How do I treat that? How do I get a second opinion? They kind of go there. I guess one question is I think that a general tool that can answer all kinds of questions, not just medical questions alone, sometimes is better. Mm-hmm. So just tell me on the idea that it needs to be specialists, especially when you've got a moderated tool where the best answers rise to the top. And also, would you think about taking these conversations and making them publicly available and/or searchable for end users?
Yeah, so the first question, I guess, is about specialists. It doesn't have to be specialists, it's people with experience, right? I'm a general practitioner, but I see a lot of stuff and I have a lot of experience. There's a great story. There's a guy, he was an oncologist in New Zealand, and he found that putting honey on these Kaposi sarcoma lesions was one of the most effective treatments for this particular kind, is honey. It took 15 years for that information to make it into mainstream medicine here. That doesn't have to happen anymore in SharePractice, right? That information he could publish that today, right?
I get it. So, but separate from just specialists, like why doctors only? Because you could have, for example, you could have the patients and others collaborating, saying, "This is how it worked for me.
Yeah.
This is what was how I was treated."
We plan to open it up to healthcare practitioners in general, nurse practitioners, but we're concerned that we're planning on opening up to patients. But the concern is that will doctors continue to contribute the quality data that they are if they know patients are consuming it, and that's something we need to be very careful about. So we're being strategic about whether or not we open it to patients. But I see a great use case for it, for sure.
So I have a couple questions. The first one, my understanding of the way the pharmaceutical industry works isn't extensive, but I know that there's a lot of various influences about trying to get doctors to use certain drugs. Are you concerned at all about pushback from the industry, and that maybe voting could potentially be not rigged, but certainly they might try to influence the way doctors vote as far as various treatment options?
Yeah, I think that's a good problem for us to have. I mean, like when pharmaceutical industry is trying to manipulate our data, I want to invest in that company. But you know, like right now, pharmaceutical reps come to my office, they're like, "Here, Dr. Brandeis, have some sushi and read this article that you're never going to read, and here's a study on this drug that we want you to prescribe." It's much more effective to me if they come in and say, "Hey, Dr. Brandeis, here's SharePractice, here's our drug, look how your peers are ranking this." So we think that we actually can work well with pharma and actually change the model of the way pharmaceutical reps work.
My second one, as a hypochondriac, I feel like I will try hard to get access to this through some means. Maybe like there's a forum with screenshots of what doctors are doing. Like, is that a concern at all? Like, even if you're trying to keep people out, I'm going to be trying to get in.
Yeah.
So, are you not afraid of me? Or,
Again, I think these are good problems to have, and the solutions are just technology solutions. I mean, it's not that difficult to curate our audience. But yeah, but we're going to grow and we're going to scale, and we'll do what we can. Yeah.
How will you handle like insurance needs or anything that goes wrong in the system? Meaning like if someone gets a bad piece of advice from the network and acts on it. I mean, I guess that maybe this is just considered a supplementary tool, another piece of input.
Yeah.
So they're covered by their malpractice insurance, or?
This is just doctors sharing their opinions. In my opinion, this is a good treatment for that. We're not saying, yes, this is that diagnosis and you should use this treatment. So our terms are very clear, doctors are very clear, and we monitor all the comments and stuff, and we're able to communicate with doctors. That's not the way this is used, this is the way it's used, and it's been fine.
So we're out of time, but that was great. That was SharePractice. Thank you guys very much.